for joining us today. Today is our last scheduled update with Dr. Bissell. At this time, if there's a need, we'll always send out an invitation and we'll invite you back. But at this point, it's our last scheduled meetup, I should say. And I'm Jen Harris from Montgomery County. Of course, joining us is Dr. Bissell, and we are glad you're here with us. So I'm going to turn it over to her. And if you have any questions, please feel free to ask those using the chat or the Q&A. Thank you.
Jen, thank you so much. Hi, good afternoon, everyone. Yes, cases are looking very good. We're still in the low transmission range, really single-digit numbers throughout the district. So our epi curves will be posted on the NRB Road to Wellness website, but are very much down compared to our peak with our Omicron surge. I know people are concerned about the BA2 variant. It has already become the predominant variant in a lot of areas. In the state of Virginia, I think it's somewhere around 30 to 35% of the cases, not quite that high in the New River Valley. I don't have the exact numbers, but it's not a predominant variant. It's been around for a little bit, and it certainly hasn't outcompeted Omicron 1. So while we may see, a slight bump in cases, we are not expecting anything significant with the BA2 variant at this time. Again, we know what things work for prevention. So as we do transition to endemic and learning to live with the virus, it's important that we do those risk assessments, the risk tolerance, and let that inform our behavior. Obviously, we continue to offer testing for those who need testing. Rapid testing is much more widely available now as well. And then we offer vaccination for all of those who need to be vaccinated, either with primary series, boosters, fourth shots for those who are immunocompromised. So those are all very readily available for those who need to get updated on them. And we'll continue to follow. Pfizer is applying for the EUA for the fourth shot for older folks, 50 and older, Moderna for adults, and then of course both of them are looking at applying for EUAs for children. We will continue those. The FDA or continue to follow that situation. The FDA has a meeting scheduled for early April, so we'll know more then. And I think that's really all I had, and I'll just go ahead and take questions.
Okay, our first question is coming in from Gene. He says, it looks like you're ready for a getaway. How would you rate how BDH has handled the pandemic locally and statewide overall for the past 2 years, having to adapt as conditions changed?
So yeah, I had to be someplace today that I didn't have access to a computer, so I am sitting in my car. Not quite a getaway, but hoping to get that soon. I think one of our strengths locally, I think locally we've done a really good job because I had the support of all of our localities. So we recognized early on that this was not something that each individual locality, whether it was Montgomery County or Radford City or Pulaski or Giles or Floyd, was going to handle on its own. And we all came together, our task force came together, we brought all of the people that needed to be there to the table. And we were able to really, the whole thing about emergency response is adaptability, flexibility, scalability, and we were able to be that. And everyone really, we took care of each other as a region. So if we needed something, people responded. We got drive-through testing up very, very early. We got Fralin on lab, the lab online to becoming a testing site for us. And then when the vaccines rolled out, we had locations, the Blue Ridge Church and Radford University, Virginia Tech. We had people kind of pony up and offer those locations for us to offer those large scale vaccination sites. And so I think that really helps a lot to have that local cooperation, collaboration, and everyone working together. At the statewide level, the federal level, it's a little bit more challenging, right? Not everybody has the same resources. Not everybody has the same population. The demographics are different. People, have different thoughts and processes in place. So you're trying to be consistent and yet maintain that flexibility. And so it's challenging. You know, I mean, I will say that there was some recognition of that, and so those of us at the local level, we did what we needed to do to get things done. I know the folks in central office in Richmond and in the different state agencies, and certainly the federal folks. You know, it's hard to craft that message to reach everyone. So it's a challenging thing, but I think we did learn very much from this response that we have to do it at the local level. You know, we've got to come together and take care of our communities. And so I'm very proud of the way our localities did that. I'm very proud of the way public health staff did that. All of the community organizations, their stakeholders, our MRC, just really proud of how everyone came together for it. You know, as far as the pandemic messaging, I think the messaging, we didn't do the greatest job in conveying risk stratification. This is definitely not a pandemic that affects everyone equally, and talking about who's at higher risk is certainly not in any way discounting or dismissing the pandemic. I mean, it was very real, and we know that it is, you know, much more serious for some people than others. And we want to make sure that we do the best we can to protect those who are at higher risk. And that's certainly not, I think, you know, social media and sometimes the media took that out of context. It seems like people are in such a binary, one or the other, that meant that was endorsing a strategy of let it rip. And it certainly was not endorsing a strategy of let it rip, but you don't want to neglect those at higher risk when you're trying to do this one size fits all. And so, like everything, it's a balance. Like everything, it's a balance. And, you know, I think we tried to be as reasonable as we could, along with being flexible and adaptable. And the same holds true for vaccination. I don't think a one size fits all approach for vaccination really fits the pandemic response. You know, again, those who are much higher risk from the pandemic, the vaccines and the boosters and everything are much more important. Those who are lower risk, you know, again, it's all about an individual's health and their history and their situation and their risk assessment, and doing that in coordination with their primary care physician and their pediatrician for children. I think it's also really important to recognize, although, you know, we always endorse immunization over infection, we do have to acknowledge and recognize that those who have been infected, they have those antibodies, so they have a degree of immunity. And when we're talking about immunity, you know, we look at community immunity through vaccination, but also through infection. And so again, for those folks, it's not going to be the same when we're talking about vaccination as it is for someone who's completely naive and has not had COVID. And then the messaging around masking became very, very polarized, and we tried to keep it very much, you know, much more common sense, much more reason, much more about, you know, protecting ourselves and doing the things that we can to prevent spread, and the basic things of infection prevention and control. Stay home when you're sick, you know, wash your hands, good cough etiquette and respiratory hygiene. So I think we did a good job of that locally as well, and some of those communications at higher levels became a little bit more confusing. Some people found them conflicting, contradicting, and then I think they became a little bit more divisive. So certainly we have a lot to learn, a lot to look back on, and reevaluate, you know, our successes and where we had challenges, so that this was a once in 100-year thing. I do think there will be future pandemics, and we've just got to be prepared for them in the era of global travel.
Okay, we have about 3 more questions in the queue. Again, if you have questions, feel free to ask them in the chat or the Q&A. Our next question is coming in from Liana. As we transition to a world where COVID is endemic, how is your health district going to transition all the energy and resources you're putting into COVID? What else is really at the top of the priority list for the NRD?
So yeah, we want to shift to more surveillance like we do with other communicable diseases with COVID. We have catching up to do for sure. Early childhood and other immunizations have taken a hit, so we're really focusing on working with our pediatricians, working with our schools, working with our families about getting those early childhood immunizations up to date. Substance use and overdoses have been really significant. So we're working to keep our MRC engaged because we built up such a wonderful MRC to help us with some of these other efforts, but getting more people out there to do outreach and get the Revive training for naloxone, the reversal drug, and to do more education about fentanyl is becoming more and more challenging because it is adulterating a lot of the drugs that are out on the streets now. So people who think that they're getting methamphetamine, if it's tainted with fentanyl, obviously they can overdose. Fentanyl is very potent, so if they think they're getting heroin or something else and it's got fentanyl in it, a much smaller dose is going to have a much bigger effect. So we're working on doing that. We are working on our, we have had more TB cases, so we're doing more TB and doing more outreach and making sure that those folks are taken care of. Hepatitis A is another big one. We had some people affected by the Roanoke hepatitis A outbreaks, both the food service one and the one with the substance using and homeless population. So we need to get out there and get people vaccinated. Anyone who's working in food service who didn't, hepatitis A didn't become a childhood vaccination until the mid-90s. So those who were born before then, especially if they're in food service, we really want to make sure they're vaccinated. But even people, who go out to eat, having that hepatitis A vaccine, or if you travel, having that hepatitis A vaccine. So doing education there, getting our restaurants back up to speed. We had a period where a lot of them were doing takeout only. Now people are dining in, so we have to kind of get back up to those regulations and those inspections and working with our restaurants. And then other sexually transmitted infections, we've seen a big bump in those. And so, we're doing our outreach again. We're starting to get more testing out and, trying to get those folks tested and treated and get their contacts tested and treated as well. So lots of other public health things that we want to channel that energy into, and we want to keep our MRC volunteers engaged. Because they're all so very willing and they want to help. And so there's lots more public health.
Great, always busy. Always doing things. Let's see. Rachel is asking, with the spring Easter break coming up, do you expect a surge in cases? What would you say to families preparing to gather and to take trips?
So again, it's about doing the risk assessment and the risk tolerance. There's never going to be zero risk. Our disease levels are very low in this area. I think most of the country has pretty low disease activity. BA2 is becoming more predominant in some areas, so they are seeing cases increase. Excuse me. But again, those who are vaccinated or those who had COVID before, they have some immunity. So somebody who's been vaccinated, somebody who's been vaccinated and had COVID, someone who's had COVID, someone who's young and healthy, those folks are in a different position and probably have a different risk tolerance than those who might be immunocompromised or higher risk. And then you have to look at who's gathering, who's going to be getting together and where. I mean, obviously, we would always endorse, if it's nice weather, to try and make it outdoors as much as possible. Or if it's indoors, that it's a well-ventilated space and it's not a small closed-in space. Traveling, our airlines still do have the mask mandates, so our public transportation, those who are driving, obviously you can control that more, who's in your car. So there are a lot of things to consider. As far as whether we expect a surge in cases, we really don't. Our colleges had their spring breaks and came back, and they went all over the place, and we didn't see any big bumps in cases. We really do think that with the Omicron surge and where we are with vaccinations and where we are with people who, have had vaccination and infection, that if we do see an increase in cases, it's not going to be as substantial, and it's certainly not going to be as disruptive Our hospitalizations, our hospitals are looking much better now. So I think we're better equipped to handle it, and we have to learn to live with it. Just like, you know, when we have a bad flu season, we look at all of these things. We look at work absences, we look at school absences, we look at what we're doing, we look at our hospitals. So we have to get back into that kind of surveillance and that risk assessment, risk tolerance mode, and how that informs our behavior.
Okay, looks like we have one more question in the queue right now. So again, if you have questions, please use the chat or the Q&A. Leanne is asking, we learned a lot about health equity in the course of responding to the pandemic. How is the NRV Health District or the New River Health District carrying what it learned in that sense forward?
So we are definitely trying to get out even more. I mean, I think the health department before COVID did get out and offer outreach and offer screenings and offer services. But we recognize that there are large subsets of the population. So for instance, when they first signed up for testing or vaccination, if they didn't have internet access, you know, making sure that we take the services to them through mobile units, and using our community partners more, right? So when we are talking about some of those most vulnerable communities, those most marginalized communities, you've got to have the right messenger and the right message. And our community partners, you know, oftentimes when we work with them, it really helps us to kind of break through and get into those communities. During COVID, we went out and we did a lot of homebound testing. We did homebound vaccinating, and certainly we have to make sure to keep that an option. And we worked with our services, our agency on aging. So, you know, again, those community partners are invaluable to extending the outreach. And, you know, we look at what all of our partners and all of the safety net organizations offer, and really just complementing each other in how we can reach those communities. And COVID really showed us that even more than beforehand.
Okay, we're getting a few thank yous coming in from Eric and Jean. We really appreciate you being here, Dr. Bissell. We really appreciate you making this a priority and making yourself accessible to all of us so that we could ask these questions. Rachel saying thank you as well. Thank you for joining us in the field and finding a way to join us today, even though you couldn't find a computer. That's how dedicated you are. So we really appreciate all that you've done, and I believe this. I think this is a wrap. I think we're done.
Yeah. Thank you for hosting these. Thank you all for participating and helping us get the word out. And I would say, yeah, we're not going to plan anymore. Certainly, if we have to, we can come together pretty quickly. We know how to reach you. But if you all have questions, please reach out to us through the Road to Wellness, the Public Health Task Force email. And we'll make sure to stay in touch, and we'll make sure to reach out to you when we need to get the message out. That's another great thing that came out of this, was the lines of communication opening up.
Absolutely. Thank you all, and we look forward to the next time, maybe. I don't know when that might be, but either way, we hope you have a wonderful week. Take care.
Thank you.